Today on Community Watch, we talk with Dr. Gary Voccio, Public Health District Manager. Long title that guy's got. We're talking about what COVID's looking like right now and a number of other issues in our 10-county area. So stay with us. Community Watch starts now. Welcome to Community Watch, and we are very happy to have with us on the show today Dr. Gary Voccio. Welcome.
Thank you, John. Appreciate it.
It's good to see you.
Yeah, you too again.
And you are the man with the longest title that I know of. You are the District Health Director for the Northwest Health District. Is that right?
Northwest Georgia Public Health District.
Northwest Georgia Public Health District.
Correct.
And does all that fit on a card?
Yes, it's very small print. It's very hard to read. Actually, the card is this big.
Well, I had my phone out to get your title, and I don't think it even has all of it on there. But I know it's been a while since we have spoken officially.
Yeah.
And the last time we spoke, it was all COVID, nothing but COVID. So I think we probably ought to start there and just see where we are.
Yeah. Well, the COVID pandemic, the pandemic part of it is probably over and quite attenuated, but we're never going to be over COVID, in my opinion. I think most of the medical experts agree with that. I'm a pulmonologist in training and critical care physician. I'm not a virologist, but physician in prior practice and took care of a lot of sick people. And we're still seeing sickness related to COVID in Northwest Georgia. The hospital numbers, thankfully, are very low. COVID cases are quite low. But we're still seeing some deaths related to COVID. I don't think we'll ever be over COVID as a disease on a chronic basis, acute basis and a chronic basis. It's going to be, similar to what somebody may have with a flu or a streptococcal infection, but we'll always be dealing with COVID. I'm predicting that, in my mind, from what we're currently seeing and what we saw in the past, if somebody gets sick with an acute disease, they're going to be tested for COVID. Like you may be tested for flu or some other infection. COVID's always going to be with us. And that's unfortunate, but we're still seeing occasional cases. We're still seeing hospitalizations and deaths. And the majority of deaths are still in people who are in the older age group, more 65 or over. So it is still an entity we're going to be dealing with, and people have to be aware that it'll probably never go away.
So do you advise at this point, and I know restrictions are really quite rare now. I mean, I've been, I guess, to get a checkup at a doctor's office here or there where masks are required, but for the most part, they're not required.
Yeah.
Do you think it's still wise in certain places and locations to wear a mask?
Well, in particularly clinical or medical settings, of course, that's where the sick go to be treated. And if you're sick with a respiratory illness, call first before you go. They don't want somebody with COVID or flu there unless you really have to be seen, of course. But yes, I think masks are warranted in certain situations. Still, in conditions that may cause other people illness, long-term care facilities, for example, there may be somebody sick there. Other nursing home type situations, clinical medical situations. In general, not really, but it is warranted in cases where somebody may be ill with a respiratory infection, and you may expose other people who may become acutely ill with that disease, with COVID. You know, the more likely you, the more ill you are with cough and febrile symptoms. If you're not wearing a mask, other people aren't wearing masks in a poorly ventilated situation, there's more likely those people are going to get sick. It depends on how sick you are, when you are ill, in timing of the illness, the ventilation the ventilation of that place, how distant you are from other people. All those play a part. But yes, in certain circumstances, a mask, an N95 mask, is warranted. Cloth masks aren't very efficient in protecting other people or you, and surgical masks do have some effect, but the N95 masks are the best masks to wear if you're acutely ill with a respiratory illness, be it COVID or flu or some other respiratory illness. It's warranted to wear a mask.
So you're recommending mask wearing for people who are themselves unwell.
Yes.
What about for those of us who just want to avoid catching something from someone who's unwell?
Well, certainly that is a good question. If you're concerned, the N95 masks are going to prevent to a degree you from acquiring an aerosolized virus like COVID. We do know now that for the most part, COVID is spread by aerosolization. Droplets, or the larger respiratory droplets, don't seem to be the method of how COVID is spread. It's very finer particles called aerosolization. N95s do have a protection against that. Both people, somebody who has a disease and the other people around them, both wearing masks, both parties, certainly is a much higher protection than only one party wearing the mask. So yes.
I know I wore a mask when I went to the airport recently, and at the airport and on the plane, but I was an outlier. I was an outlier.
You were in the minority. To be even getting to the science of that, airplanes have a very, very high turnover of air in the airplane. So, and if you turn on the little nozzle, that blowing nozzle of air certainly will disperse an aerosolized virus. But the airplanes have a very high turnover, and that's what you should be mindful of. And that comes to the point of high ventilation capacity of a room or wherever you are. The more ventilation, the less likely that virus is going to be maintained in that local environment. So, it's a good point to continue to monitor that, if you monitor your surroundings for things like that.
Now, for a while, we were hearing stories about symptoms related to something called long COVID.
Yeah.
Is that still
yes,
happening?
The science is still seems to be unsettled at this point. At one time, about 6 months ago, the scientific literature was saying that at least 20% to almost half of the population who acquired COVID would have long COVID symptoms. That seems to have now been changed to about 5 to 10%. And that's anywhere from chronic fatigue to headaches to, just neuromuscular weakness. So yes, there is long COVID, but anybody who has an acute disease, whether it be a flu-like syndrome or any kind of real significant severe disease of any type, is going to experience some sort of long-term recovery. In my career, I experienced that taking care of people who required, an intensive care stay for a long period of time. it took weeks and months for those people to recover. So it's just not COVID per se, although COVID does have long-term symptoms. If you're acutely ill with any disease, you're going to have a long time to recover. So COVID really is not unique in that. There are certain differences, neurologic differences, chronic headaches, but fatigue, shortness of breath in those COVID patients, yeah, that's to be expected. It just really doesn't surprise me at all.
Mm. And the vaccination or booster shots, is there any indication yet that there will be, like moving forward, just a single annual shot? Is that what you anticipate will happen?
I anticipate that. The vaccine-related biologics committee is going to be meeting in May. And that's that large subgroup of professionals, academicians and virologists who are going to meet in May and make recommendations to the CDC and the FDA in particular where we should go with another vaccine. And they're probably going to decide, I think, from what I've been reading, that one shot of a single, possibly, hopefully, universal type COVID vaccine will be in the offing. And when will that happen? Probably in the fall, I anticipate, just to make it easy for people, if they want, to get their flu shot and their COVID vaccine. I suspect that's what they're going to say. They may also say, and this is going to be a difficult prediction on my part, but they may also say, look, if you're young and healthy, you may not need this shot, but if you have medical conditions, diabetes, obesity, heart disease in particular, those three, or in an age group over age 60, 55, I'm not sure what they're going to say, yes, we strongly recommend you get this vaccine. Mm-hmm. Other individuals, possibly not. So we'll wait and see, but that's coming out in May.
Okay, all right. Well, we can talk about other stuff.
Yay. There's a lot of other stuff to talk about.
Yeah. Well, I did want to bring up, because I read locally that our area, as the area you serve, has a, I guess, disturbingly high opioid usage.
We do. We
That's
do.
But high, as high as anywhere in the state?
Yes, the highest in the state. The overall raw numbers are very small. And when we look at what's called our OD map, or overdose application process map, it's a map that our first responders employ. They put in this data. The numbers individually for each county is relatively small, but for the population, it's quite large. It is very disturbing and quite large. Numbers vary from week to week. I get from our emergency management team on a weekly basis state numbers. And our numbers vary from county to county. They'll have a cluster in one county one week, the next time it'll be not present. And at any one time we have in Northwest Georgia in our 10 counties anywhere from 5 to 15 overdoses, typically opioid, typically fentanyl in our 10 counties. And that varies. The death rate per population, however, is quite high. When you even it out for the population, it is high, and is primarily fentanyl.
I know we're coming up on a break, so let's take that break, and then we'll be back with much more conversation with Dr. Voccio after this. Stay with us.
I know you've had your moments of doubt and struggle, and I'm here to say I'm proud of you.
And although each one of us may take a different path, may we look back upon today as the moment we stepped into a larger world, a greater world,
You will pass this way but once. Do it right.
If ever there was a time to follow your passion and do something that matters to you, now is certainly that time.
Welcome back to Community Watch. We're having a conversation with Dr. Gary Voccio, and I'm going to ask you to give us your title so I don't mess it up this time.
I'm the Public Health Director for Northwest Georgia Public Health.
Well, see, it didn't sound so bad with you saying it. We were talking about opioids and the fact that our 10-county district is has the highest rate of deaths due to opioids in the state. But you wanted to make it clear those numbers are low.
The raw numbers are low. They're small numbers. But when you relate it as you do in public health, we always have to have a denominator of 100,000. That's just so everybody is on the same page and even statistics. But when we put it in raw numbers, the numbers are relatively small. And I showed John the numbers a second ago. The numbers range from 10 to 15 a week in our Northwest Georgia Health District. In each county, those are different numbers. It can range from anywhere from 3 to 10 per county. If you have a county that has a small population, when you put it in a statistic term of 100,000, those are very high numbers. Georgia, on average, has 16 deaths per 100,000 population. If you, for example, take Dade County, which is a very small county in population, their death rate for opioids is 36 per 100,000, which is extremely high and alarming. The raw numbers are small, but for a small population, that statistically is a high number.
Yeah. So what can we do about this? I mean,
well, you know, first and foremost, addressing it has been very difficult. The population that we are dealing with are typically not people who seek medical care until it's a necessity with EMS responding. But what we have done is there was an attempt to try to deal with this in Bartow County, and we have to give the highest compliments to Bartow Recovery, which is an opioid community response organization, and they were able to affect by going into the community using ODMAP. They were able to affect a decline in their numbers that I have here for opioid use disorders. And using the opioid distribution map, which is a government type map that focuses on a zip code. For example, if somebody has been identified as an overdose victim, Bartow Recovery went to the community and with their employees there, people who have recovered from addiction, would canvass the neighborhood and try to get people into recovery. That has been so well received in Bartow County. We have 4 other community recovery organizations to also take this on. They've been given a grant by the CDC, and I want to name them because these are remarkable people. Living Proof Recovery of Rome, Your Haven, Place of Recovery in Haralson County, Highland Rivers Behavioral Health in Cedartown, Rome, and Cartersville, Mosaic Place in Cedartown, and Living Proof Recovery has also been added to this, and Unified Recovery in Lafayette. So these are 4 other community recovery organizations that has been given a grant to not only do what Bartow Recovery did, but in other parts of our 10-county Northwest Health District. Bartow Recovery actually touched 2,000 individuals in Bartow County to get them into recovery or address this in the community to get people into recovery programs. So we're trying to do our best to do something about this. And 4 other organizations are now being given grant money to do this.
So, and I don't know if you even know this, but I was just curious, is the fentanyl that is causing these deaths, is that prescription medication or something that's been homemade?
I do not know that, at least in our health district, but I am making the assumption this is the homemade variety that is being delivered into our state in Northwest Georgia.
Mm-hmm. Well, maybe we can reach out to some of those organizations to come on the show in the future.
I actually met them about a month ago with our emergency management director, and they have remarkable stories. They're all in recovery, have been there, know what the experience is to have opioid use disorder, and the folks that are in these recovery programs that are given the grant have to have at least been in that situation and have had at least 2 years of recovery. Mm-hmm. So they've experienced it and know what it's like.
Yeah. Well, all right, so that is a very serious health situation in our district. What else is going on that we need to be concerned about?
Well, not only is we're concerned not only with opioid, but we also have an unfortunate new drug out there called xylazine, which is tranq or zombie drug, which is being mixed with fentanyl. And over the past 4 years, we've had 16 deaths related to it in Georgia, and we're now, last year we had almost 200 deaths related to tranq, which is a pharmaceutical used in the veterinarian industry for large animals as a tranquilizer. It's being mixed with fentanyl, and all of the deaths from this tranquilizer, tranq, xylazine, has been also combined with fentanyl. So these folks inadvertently or knowingly take fentanyl, it's mixed with the xylazine, and people are dying from it. We've had almost 200 deaths. So something else to be on our radar, and people have to be very concerned about taking a non-prescription drug mixed with xylazine.
Well, see, that's a new one on me.
Yeah,
I hadn't heard
it's
that.
very concerning. We've had 15 deaths, almost 15 deaths 3 years ago, now almost 200 deaths.
Goodness. And is that also a homemade situation?
No, I think it's a pharmaceutical, like I said, an animal pharmaceutical that's being either, obtained by these drug dealers somehow, or sold under the table somehow, or whatever. But it is very, very worrisome for public health.
Mm-hmm. Well, in addition to these drug-related concerns, what else is your office dealing with or watching?
Well, on our website, we have added a Hoping for Recovery on our website, which is a new part of our website to look for drug trafficking children. It's something that has we've been made aware of sex trafficking children of young age. People need to be aware that a young child who may be sex trafficked has new tattoos, a new cell phone. And on our website there's educators, a page for educators to be aware of what to look for in a child who is sex trafficked, law enforcement, what to look for in a child who's being sex trafficked, and even parents, what to look for if your child is being approached by a sex trafficker. So this is something also that we put on our website for law enforcement, educators, and parents to be aware of. So something else that popped up on my radar just a few months ago, and we decided to put it on our website.
Tell us what is the website? So
NorthwestGeorgiaPublicHealth.org, and on that website you'll see COVID numbers, influenza, and also there is Recovering Hope, which is the site for sex trafficking children.
Yeah.
Very worrisome for me. I have little grandchildren growing up, and it was quite alarming.
Yeah. So, how do you? You mentioned learning about this on your just reading online. How do you get your information about what's going on in the district? Is that
it is given to me by our public health nurses on regular reports, our clinical nurse managers and our program managers. Our information officer will, that's his job. His name is Logan Boss. Most people know him, but Logan will come to me and say, this is something you need to be aware of. Emergency management person, her name's Reba Wilson, is part of our opioid detection program. She'll come to me and say, this is new on our radar, you need to be aware of this. And we had a meeting with these folks, Highland Rivers and Recovery Rome, et cetera, Recovery Bartow. And that's how I'm aware of the new stuff. And then for the most part, emails from our district health, our state health director, Dr. Toomey, et cetera, et cetera. So that's how I have to keep up with this information.
It's really quite a variety of sources.
Yes, it is. And just medical reading in general. I get multiple journals every day, and I subscribe to some, and so that's where I get the sources.
Yeah. I wonder, do you get to focus at all on preventative medicine, or are you mostly reacting to something that's happening?
That's a good thing, good question. I have given lectures on, for example, Healthy People 2020 and prevention of, staying healthy, trying to prevent chronic health diseases. But right now we're in kind of more reactive mode. I think prevention is the cornerstone of public health. Right now, we're trying to get back into prevention, but it's been very difficult with COVID.
Right. And it's one indication that COVID is not the huge concern that it was, because we're able to talk about some other concerns.
Yeah, you're right. Unfortunately, we are.
Yeah.
But the cornerstone of public health is preventive medicine and community health. And I think your audience would be interested in reading about Healthy People 2030. Healthy People 2030 is an initiative primarily by the CDC and public health, broader public health. But it is quite interesting. Started in 1979 by the Surgeon General, and for every 10 years there is a plan in place for people to maintain health and not become chronically ill, and maintain your health. But Healthy People 2030 is something very interesting to read about.
Now, is there information on it on your?
Not on our website, but if anyone wants to just Google whatever their internet browser is, Healthy People 2030 is a very interesting read. A lot of interesting details about chronic and acute health and staying healthy.
And one more time, let's hear your web address.
NorthwestGeorgiaPublicHealth.org.
Okay, good. Because I think we're about out of time. Thank you so much.
Thank you. I enjoyed it.
And
I'm glad I could make it.
Please feel free to bring us whatever's going on.
Invite any time. I'll be glad to. A lot of information.
Thank you out there for joining us on Community Watch. We'll see you next time.